Welcome back to Village in Motion this Thursday, December 14th. I'm glad that you decided to stay with us and join us for this segment of the Village in Motion show today. And for this segment, we have the interim operation manager from Home Health by the name of Kathy Duckett. And we are so glad to have Kathy with us. And you have been with us how long, Kathy?
I've been here since the middle of August.
Oh, okay. Almost reaching that 6-month part.
Right.
Okay.
I'm filling in, and while they're looking for a full-time operations manager.
Okay.
So my experience is in home health.
Mm-hmm.
I've been in home health care for, I tell everyone 100 years, but that may be a little exaggeration, but for at least 30 years I've been in home health.
Oh, tremendous.
I started off carrying a bag and going, working on the streets as visiting patients in their home, and then became a manager, a clinical manager, and I've been a regional manager in Los Angeles, and pretty much if you've done it in the home health arena, that's the jobs that I've had.
Okay.
And currently I'm a consultant with Fozzie and Associates, which is a national consulting company, and I'm here helping out and keeping things going with this great team that we have in home health, taking care of the patients here at Green Spring.
So you are a nurse.
I am a nurse, yes.
Okay. And you've had all these different jobs in home health.
Yes.
What really is home health? I mean, there's this big confusion, even for myself, about the difference between home health and home support. Yeah.
So that's a great question, and it's not just you; it's the entire country. Actually, it's interesting when I read articles and they'll talk about home health care, and they're really talking about home support type services. Yes. And I think that it makes it then difficult for anyone who's not in the business to understand what that is.
Right.
When I talk about home health care, I'm talking about the certified home health program, certified by the federal government, the Medicare program, to provide intermittent skilled care for people in the home, and it's expected to be for a short duration. In the 1960s, the Medicare government decided that they needed a transition from people who were in the hospital, completely cared for in the hospital, to completely independent in the home. So at that point, they decided to create a home health care benefit covered under your Medicare coverage. Right. It's under Part A, so it's the same coverage in your hospital. It's 100% covered.
Okay.
But the idea was that you required the services of a skilled clinician, a nurse, a therapist, physical therapist, occupational therapist, speech therapist, to help you learn how to be independent in your home environment with this new disease process that you had, or with an exacerbation of a disease process. So if you're sicker and you end up in the hospital, or you end up in an acute situation, or even at a doctor's office where you're getting worse and you're putting on new medications, and you just need some help to get to independence, then the federal government said, let's pay for that to help keep people out of the hospital.
And you had said it's designed for a short term. What's the short term? I mean, in our society, short has different meanings. Great
question. So the federal government determined that it would be 60 days.
Okay.
So when we talk about an episode of care, it's 60 days. Now, that doesn't mean that you're going to be with us for 60 days, but that gives you the idea that it's not meant for someone who needs help forever.
Okay.
So if you find that you just need help with getting your medications, putting your medications together, and you're going to need someone every week to do that, then that would be home support. You'd want to call them. If you have new medications and you need to learn about your new medications, or you need to learn how they interact with your disease process, then you would call us, because our goal is to help you be independent. And if you're not going to be able to do that, work with social workers to help you get the resources you need, so that after we leave, you still have the support you need.
So, in a nutshell, then, home health is to return you to your highest level of functioning?
Absolutely. Well said. I couldn't have said it better. Exactly right. And then so you're either going to go back to where you were, but if you can't, if your disease process has progressed to the point where you can't, our goal is to make sure you have the support in your home that will enable you to stay in your home as long as you can.
Okay. You mentioned the fact that it's a Medicare program, which automatically says to me it has to be approved by a physician. Is that right?
Exactly right, yep. So what happens is the doctor orders it. If you're coming from a hospital, the hospital doctor can order it. The discharge planner at the hospital can do it. Any one of our doctors here at the medical center can order it.
Okay.
And it's actually, you can call up and say, I'd like to have home health services. We will then get in touch with your doctor and see if we can get a doctor's order. So it can come from you. If you say, you know, I think I need some extra help and I think I need it through home health, then we would talk to you on the phone about what you really need, and then we could then contact your physician and then get the order from them. So if it doesn't come from the doctor, we can circle back to the doctor and make that happen. We know the regulations really well. The people in my office know the regulations really well. So if based on what you're telling us, we don't think we're the right source, we are very fortunate at Green Spring to have home support services right here. We will make sure that we make those contacts for you, either back to the social worker that works in your area or into home support to help make that connection for you.
And so with home health, then a nurse would come out after you get the physician order. You describe what's going on with you. The nurse would come out and evaluate you?
Yep, the nurse would come out. So generally, the nurse would come out and evaluate you and see what you needed and see what we could do based on what's happening with your disease process, with the needs that you have. We will talk with you about other services. So you may need nursing and physical therapy and occupational therapy. Physical therapy is physical, getting up and moving around and getting in and out of the shower and really ambulating better. Occupational therapy is your activities of daily living. You're needing help with how to manipulate stuff within your home environment, maybe shower chairs or that kind of stuff. You could need speech therapy. Speech therapy is not only for people who have problems speaking, but it's also for people who may have some cognitive issues. So we can do a speech therapy eval. While we're in there, though, the federal government allows us to provide a home health aid for free. It's part of the covered benefit for short, intermittent periods of time.
Again, another 60 days?
Yep. So as long as you have the skilled care, then you can get the home health aid for free. And we encourage people to utilize that resource. You could have both. You could have home support on certain days and then the home health aid on other days, but it's only as long as you're getting the skilled care. Let's say you fell and broke your hip. Then you get sent home to the hospital. You're not quite ready for outpatient therapy. There's a difference between outpatient therapy, even though we do it here at Green Spring. Home care really is going to help you figure out how to be safe in your home.
So you're not going to a center?
No.
You're not going downstairs or across the street? You're doing it within your apartment?
The therapists come to you and help you be safe in your home. And at that point, you may not need a nurse. You may just need therapy, which is absolutely fine. So what we will do is determine within your benefit what services are available. Now, the Medicare has this as a benefit. Other insurance companies do as well. So just because you may not have Medicare as a primary yet doesn't mean you don't qualify. Give us a call. We'll check your health care benefit. We'll let you know what you're covered.
You just mentioned give us a call. What's the number?
Oh, my gosh.
No problem.
I don't know. Oh my gosh, that's horrible. I don't know that.
We can always look it up.
Yeah, thank you.
And if we don't find it in the directory, we can always call the front desk.
If you call the 6400 number, they will, it's 604
4600.
Yeah, yep. They will definitely connect you right to us.
Sounds good. Kathy, thank you so very much for coming this morning. It's been wonderful, and I just learned a lot about home support and home health.
Well, thank you. Thank you.
And the difference there, Ed.
Yes, thank you so much. Pleasure to be here.
Thank you.